Hi, Mrs. Perry. It's Vicki, your CNA, and I'm here to do female pericare. I'm going to sanitize my hands. I'm going to gather my equipment, Mrs. Perry, and then I will be right back and we'll get started. Covering all surfaces until completely dry. Okay. 6 washcloths. Waterproof pad. Pair of gloves. And a basin and soap. And I will also need my laundry basket. I'm gonna get my comfortably warm water. I'll be right back. Get my comfortably warm water. I'm gonna get it from the warm side, not too hot, but it does need to be warm. Okay, I only need about 3 cups of water or so, and headed back. I have my comfortably warm water here. Okay. I'm going to pull the privacy curtain. That is a bolded item, and it's a key step, so if it's not done for female pericare, then it is an automatic fail. So I'm going to go ahead and pull my privacy curtain as far as my test observer wants me to. So I'm pulling my privacy curtain. I am going to raise the bed. All right, we're going to get started, Mrs. Perry. Raising the bed to comfortably working height. Generally, that's about the waist level. Okay. All right. I'm going to put on my gloves. And while I'm putting on my gloves, just a side note, barrier towel is optional. If you want to put a barrier towel, that's absolutely fine. It is not in the skill book for the state board, so it's not required, but if you would like to put one down, it's certainly acceptable, and it's acceptable. You won't lose any points. You won't get any extra points, but you're welcome to do so. I'm going to proceed without the barrier towel. All right, I'm going to put my sheets down to the foot of the bed, and this time I'm going to ask my test observer to step over to the other side of the bed, please, so I can apply my waterproof pad. Okay, all right, Mrs. Perry, I'm going to turn you over. Test observer, if you can hold her. Thank you. I'm going to apply my waterproof pad now. It doesn't matter which way it goes, long ways or vertical or horizontal, it doesn't matter. Roll it up and just tuck it underneath. All right. Thank you, test observer. The test observer will hold the mannequin for you. You don't have to ask. They will do that to help you out. Okay. At this point, I can expose my mannequin. I've already pulled the privacy curtain, and I can expose the mannequin by raising the gown to the waist level. I'm going to get started. I'm going to use a washcloth in the 4 square method. Now you can use the mitt if you'd like. However, it's more difficult to use that way and to prepare it. You can use the mitt if you'd like. However, we prefer and we advise you to use the 4 square method here at AMTI. So you half the washcloth and then you half it again, so you have 4 squares. So you need to put soap on all 4 sections of the washcloth. So here we go. A little bit of soap there on the first side, and then soap on the second, third, and fourth corner of the washcloth. All right, I'm ready to start. I'm gonna start on one side with the clean portion of the washcloth, get another clean portion of the washcloth, Clean on the other side, and then with the third portion of the washcloth, separating the labia from top to bottom. Each stroke is from top to bottom. And then I'm disposing my washcloth. I don't put soap in my water because I need rinse. Again, wringing your washcloth well so it doesn't drip. Now this is my rinse. Again, 4 square method, just to show you. Washcloth, half, and then square. Again, clean portion of the washcloth for every stroke, using the corners. You rinse the side. It doesn't matter left or right first. Clean portion of the washcloth, the other side, and the third side, separating the labia top to bottom. All strokes must be top to bottom. Disposing of my washcloth. Now is my pat dry. It doesn't matter the order in which you dry, just as long as you dry. Dispose of that. Cover the mannequin. Test observer, would you stand on the opposite side? I'm going to turn Mrs. Perry. All right, Mrs. Perry, I'm going to go ahead and turn you. The test observer will hold the mannequin. You don't have to ask them. They'll do that to help you out. Same technique in the back. Washcloth, 4 squares, using a clean portion of the washcloth for each stroke. Doesn't say on the state board how many strokes, but we just recommend 3. Again, putting soap on each corner of the washcloth, and we will do 3. Here we go. Starting from vagina towards rectum. 1, clean portion of the washcloth for each stroke. 2, so that's the side, and then 3. So it's middle, side, and side, and it doesn't matter the order on the back, as long as you go from vagina to rectum. That's the wash. Same technique for the rinse, 4 squares. No soap on this one. Clean portion of the washcloth for every stroke. Side, side, and middle. Again, from vagina to rectum, every stroke. Dispose of my washcloth. Now I pat dry. No specific order or sequence for drying, just pat dry. Cover my mannequin. Get rid of my waterproof pad. Thank you, test observer. Bring the mannequin towards me, folding the knee, grabbing at the shoulder, rolling to contain the soilage. Dispose of my waterproof pad. All right, Mrs. Perry, we are done. I'm going to lower the bed, and then I'm going to get rid of my supplies and clean up. Lowering the bed. All right, Mrs. Perry, I'm going to clean up, and here's your call light and water within reach. I'm going to clean up, and I'll be back to check on you, finish up. And dispose of my water and rinse my basin. It's not, you don't have to wash the basin with soap, just simply rinse it with water. Doesn't matter if it's warm water or cold water, just rinse it. Thoroughly dry the basin. Put that aside. Remove your gloves. Dispose of your gloves in the trash can. And at this point, this is where we begin to wash hands. If you have anything that's obstructing your wrist, a watch or anything else, you either need to remove it or raise it so that your wrists are free so you can wash those too, which is part of the skill. Going to turn on the water. It doesn't matter whether it's warm water or cold water as long as you turn on the water. Okay. Wet your hands. Generous amount of soap. And you wash for 20 seconds, interlacing the fingers. Fingers pointed downward, washing the wrists, both sides, 20 seconds. You can say the alphabet or sing happy birthday 2 times, or just watch, time it on your watch, whichever you'd like to do. You can take your watch off, put it on the countertop if you'd like, and monitor the 20 seconds that way, but it has to be a minimum of 20-second wash. Scrubbing your palms, interlacing the fingers. All right, and this is where we rinse. That's 20 seconds. There's no particular way or order for rinsing, just rinse. As long as you don't touch the sink. And if you do touch the sink, you just start all over again. Just tell the test observer you need to restart. So rinse your hands thoroughly and your wrists. Got to leave the water running. I know it's difficult to watch it run, but you just got to leave it running while you're drying your hands thoroughly. Okay, once your hands are thoroughly dried, it doesn't matter how many paper towels you use, as long as they're thoroughly dried. You'd use a clean, dry paper towel, not a wet one, to close the faucet and dispose of your paper towel. Right, now that I'm done washing my hands and rinsing and drying my basin, I'm going to put my supplies away, back to storage. And once again, my call light and water is within reach. I've already lowered the bed before I walked away. I'm going to open the privacy curtain, and Mrs. Perry, we are done. Call if you need anything. Task complete.